Drug-induced liver injury can occur after the use of both prescription and over-the-counter medications as well as other supplements. Presented patient is a 25-year-old basic trainee presenting with suicidal ideation. He was also experiencing nausea and anorexia. Recent history of admission to the psych ward 1 month prior, which at that admission, patient was admitted due to a suicidal attempt after ingestion of 14 400 milligram ibuprofen tablets. His exam was notable for scleral icternus and tenderness to palpation in the right upper quadrant. He was also experiencing suicidal ideations and auditory hallucinations. His labs were notable for an AST of 1,544 and an ALT of 4,376. The only prior data was 1 month prior, at which point they were 134 and 310 respectively. The remainder of his workup was negative except for elevated urine copper and serum iron. The patient was admitted and hospital course notable for treatment that included N-acetylcysteine as well as steroids across 2 separate admissions. For a brief time, the patient was on a copper chelator due to concern for Wilson disease. Medications are known to have the potential for liver damage, but each one's potential for harm and necessary treatment is not well known. The diagnosis of drug-induced liver injury requires exclusion of other causes of hepatic injury. It should be noted that during this evaluation, elevated copper and iron levels can be misleading. Treatment for drug-induced liver injury continues to be unclear, but both N-acetylcysteine and steroids should be considered. In our military population that often has access to NSAIDs, close monitoring should occur after ibuprofen overdoses, regardless of the amount ingested.